by the gonads. What are the gonads in male? The testes. Okay? So whenever you ask it about the testes, the coverings from outside is the scrotum. And then we go inside. Can I have a pen or a pencil just to anything? Thin. Need a thin one. So that with the anything. Thank you. So you have the coverings of the testes are two. The innermost is called tunica albuginea. The outer is tunica vaginalis, and between the two we have a space where a thin fluid is going to be there. If that fluid is increasing amount, what you call it? Whiteberry? Hydrocele. Hydrocele. Okay? So if these are the testes, what lies on top and posteriorly located to the testes? The organ called epididymis. What is the function of the epididymis? Sperms are done inside the two testes, where? In the semi-nephros tubules. And then they're going to be stored in the epididymis. Epididymis has a head, body, and tail. At the end, whereas the tail is there, the vas difference is going to start going up. I need you to please remember, the vas is not the only structure coming up from the epididymis. All these structures are included all together in a structure called, what's the name of such a structure? What? Something?
Cord.
Spermatic cord. Spermatic cord. What are those contained inside the spermatic cord? It has a thin covering fascia. Inside it, can you see? This is the vas, number one. When you're asking, give me the most important item, which is the vas difference. Plus, these red color, these are the arteries supplying the testes with nutrition. Their name, testicular arteries, maybe one, maybe two. And then the bunch of veins, huge amount of veins. They all can be named as pampiniform plexus. They are draining the contents from the testes back to the heart. So all together, plus we should have one nerve. It should be green, but I don't think it's clear in this mannequin. What's the name of that nerve? Ilioinguinal nerve. Ilioinguinal nerve. All these structures, one more time. The vas difference, testicular artery, pampiniform plexus, plus the ilioinguinal nerve. All together covered by a facial sheath, connective tissue sheath, and they're all named spermatic cord. Where do they go? They ascend up like this. At that region, this is the inguinal region. At that level, from here to there, they are running inside a canal. Do you know what's the name of this canal, Diane? Inguinal canal. Inguinal canal. This is the canal where the site for vasoligation, we can open the coverings of such a canal and we do ligate a piece of this vas difference. And then the vas is going to be turned into the inside of the pelvis. We'll run down this way and we'll go to unite with the tube coming from this gland. What's the name of this gland? Seminal vesicle. It's seen from outside, not from inside. This seminal vesicle will give a small duct, will unite with the vas, and the two of them will give what's called ejaculatory duct. Where such duct is gonna end? This dark brown is the prostate. What is the prostate? It's a gland surrounding the neck of the bladder, lower down. If this is the bladder, nearby the neck of the bladder, we have this one. The ejaculatory duct will run through the substance of such a gland and will open into the urethra. At that level, where the prostate ends, this is the first part of the urethra called prostatic urethra. Okay? So when we demonstrate such structures before we go into the interior, this is the vas, this is the spermatic cord. What is that crossing tube? What do you think? You don't know. Colleen. Heidi. Surgeon. You retard. You retard.
Just call me retard.
Not a retard. You retard. What is the ureter? He's not a retarded guy, okay? Okay, if you follow this one, it should be coming lower down from the kidney high up. And it crisscrosses this thing, okay? Where here, I have the same tube there and I have another tube there. So most likely this is the ureter of the other side. This is the ureter of the other side. And most likely this is the vase of this side. So I have one vase here and the other vase from the other side like this one. The ureter should make crossing for these two big vessels. What are the name of these two big vessels? Iliac vessels. The iliac artery could be the common iliac and the common iliac vein. So crossings, you have to keep an eye open on these. So here is the end of the aorta, and then the common iliac arteries go down this way. Okay, if I ask you, what's that thing? We had it in the female. Cecum on the left side.
Oh.
It should be one of the loops, most likely from the sigmoid colon. Okay? So, and this,
Anus, rectum.
rectum going, anus is lower down.
Wait, so
Does
that's
the anus high up like that?
That-
So, no, it's not the cecum. If you got misled, just let me know one of the loops of the large intestine. That's it. We're not sure which one. But this one is 100 sure it's the rectum. Why? It's ending in the anus in the back. So, with a cross section in the male pelvis, what is most anterior structure? The urinary bladder, followed by the GI, which is the rectum. Urinary bladder is anterior. Nothing in between. We're going to compare this with the female reproductive. I'm going to review it one more time. Okay? If we had this and you are asked either in this or in that specimen, let's go for this one. This is the bladder. What are these things?
Rogi.
Rogi. Is it when the bladder is full or empty?
Empty.
Empty. It shows such wrinkles. Okay, so if this is the bladder and this is the urethra, we need to know the parts of the urethra. Okay, parts of the urethra. Once here, this is the prostate. So from here to there, it is the prostate.